want to go for surgery, I would not advise you to go for a laparoscopy surgery, because normally what that surgery does is it shakes your womb, and definitely sometimes some people after the surgery, after the laparoscopic surgery, they can't really carry a baby full term. Like the way I asked him question, he said, I see someone that has made a lot of research. I told him, I have made a lot of research, a lot. That's what I told him. He said, no, from the way I talk, he knows that I've done a lot of research, and he gave me so much accolade. He said, some people just come here, they've not done any research. And I told him, like, you are the 8th doctor I'm seeing for this issue. And I want to put it out there that if you're suffering from fibroids, walk around. Let me just give you a recap. When I had that very big palpitation, like I used to have very severe palpitation, I thought that something was happening with my heart. So I went to a cardiologist who ran some tests on me. He did everything. He told me your heart is okay. Nothing is wrong with you. Your arteries, your ventricles, everything is fine. The only thing you have is anemia, and it's because your blood is too low, so it's affecting the way your arteries pumps blood. He said, what have you decided to do about the fibroids? And I told him, I'm sure I'll go for a surgery. He told me, he said, there are different procedures for fibroids nowadays. He said, walk around. I told him I've done. He said, very good. He said, but continue walking around. So you gain knowledge about the different procedures and you choose which one you want. Don't let any doctor force you to do what you don't want to do. That was coming from another doctor. So coming back to me and Dr. Rajesh appointment, he did a little check on me. He explained to me the procedure he's going to do. He took a marker and wrote on my stomach and told me that's how he's going to do it. This is where he's going to make the mark and everything. He said, don't worry, you are in safe hands. That day he told me, where is your MRI scan? I told him, I don't have it here with me. He said, just go to the hospital. Tell them to give you your MRI scan in a disc. I was like, doc, you can just do another MRI scan. He said, no, I need to see the MRI scan of the different doctor. And that was when I knew that I'm dealing with an expert, because most doctors will just only want to do an MRI scan. But what he did was requesting for the MRI scan of the last doctor, which made him stand out. He said, bring the MRI scan of the former doctor. Let me see what's going on first. So fast forward, I went to the other hospital. I took the MRI scan. I came and gave him. So he went through the MRI scan and he told me, okay, so I see what I'm dealing with. Right now, I'm requesting for my own MRI scan. So what is an MRI? Defined as magnetic resonance imaging. It scans the bits and pieces of everything the doctor wants. So that's why most doctors would request for that particular scan. MRI scans are a lot to handle. I came that day for my MRI scan, and that was the 5th and the last MRI scan I was going to do. So when the results came back, he looked at it and he was able to count the fibroids. We talked about it. We talked about the number of fibroids he saw in the reports. We talked about everything. He gave me his pre-operation rules and regulations. He told me the surgery he's going to carry out on me, which is laparoscopic myomectomy with power modulator and endobac. What is laparoscopic myomectomy? It is a minimal invasive technique to carry on surgery, especially for those that are suffering with fibroids or pelvic or any other problems. So he told me how it's going to be done. But what was different is he's going to use a power modulator. What is a power modulator? A power modulator is a medical device that is used to chop tissues like fibroids, like growths, into very small pieces. When he cuts the fibroids inside of me using the laparoscopic technique, the power modulator is going to chop off the fibroids inside of me in very tiny pieces. When the modulator chops the tissues or the fibroids or the growths, it's going to be directed directly into an endobac. So what is an endobac? An endobac is a plastic sac where particles of the chopped tissues are being redirected into. So that's how science has made it very easy, because before the inventions of endobag, when tissues are being chopped, sometimes particles can be left in the patient, and if, for example, it's a cancer, it will definitely spread faster. After he gave me a thorough explanation of what the power musculator and the endobag and how the laparoscopic surgery was going to look like, he gave me articles for me to go and read to understand what that was all about. So I read through it, and I read through his pre-operation rules and regulations he gave me, and everything sank in my brain very, very well. So fast forward to close to the date of surgery, I came in and signed my consent form. I also had to do some blood tests. One of the most important tests I did was CA125. A CA125 test, that was the second time I was doing a CA125 test, because the first time I did in the Canadian hospital with the head of gynecological department, then I had to do it again with Dr. Rajesh. That test is like a tumor marker test. So if you are having fibroids and you really want to go for surgery, tell the if the doctor does not tell you to do a CA125 test, tell the doctor to conduct the test for you, because it's very important. He also did tests like a full blood count, iron count, and also other tests. Amazingly, my HB at the time of surgery was 11. With your hemoglobin being 11, I'm very sure it's going to carry you through the surgery. We are just doing the blood group test to keep blood, because as per what he told me, they don't have the authority to keep blood. They don't have blood banks, so the blood comes from the government hospitals. So he said, we have to do your blood group, so we go to the government hospital and get the blood ready for any unforeseen circumstances, but I'm not sure you're going to have a blood transfusion. I don't even want to transfuse you anything. That's what he told me directly. In regards to him not wanting me to have a blood transfusion, what he did that was very important was stopping my period. So he gave me a medication called Primolat that helped to stop my period from coming, so that I don't need to bleed and maybe need to have a blood transfusion. He also prescribed some medications for bowel preparations, of which I had to take it 3 days before the surgery to prepare my bowels, so that my bowels should be free and very clean before surgery day. This medication made me to use the bathroom so frequently. Literally, I had to empty my bowels until I had to start excreting just water. Another thing I had to do was to see the anesthesiologist, who really counseled me. She asked me if this is my first time of going under anesthesia, of which I said yes. So she gave me a lot of counseling. I had to do a whole lot of tests with her as well. The HIV test, I had to do some liver function tests as well from her. So it was a preparation from both sides. That's how Dr. Rajat prepared me prior to surgery. They had to wait for my health insurance to approve the surgery. Some people's health insurance take 1 or 2 weeks to do the confirmation of the surgery, but as God would have it, because my insurance is one of the best in the UAE, within 24 hours, my surgery was approved. I was booked for surgery on the 7th of December 2022. Normally, when you book you for surgery, they give you a check-in time. So my check-in time that day was 8:30. Normally, because I live alone, I don't have family here, and my friend circle is very slim. When I tell you very, very slim, it's very slim. I had to do some preparations for myself. I had to call one cleaner to help clean my washroom, and I paid her. I had to clean the other section of my house. I had to cook my food. I prepared fried spinach, I prepared hot pot, and I prepared yam porridge. I needed something that was very soft but very yummy. Those were the 3 dishes I prepared. I also had to go out. I bought myself fruits because I love a lot of fruits. I love oranges, watermelon. So I just had to buy the fruits that I really like. I just bought and kept them because I knew for sure that I would need it after the surgery since I'm alone. And on the day of surgery, I had a bag where I just had to pack the stuffs inside because I was so confused. I didn't know what to take, because it was my first time. It was my first time of having surgery, so I really did not know what to take. And on that day, I just had to pray to God. So you see me kneeling down, I was telling God, God, this is me. That's all I was saying, because trust me when I tell you, I didn't have anything to tell God, honestly, because it was like I've had enough. of which I cannot even speak. See, my heart was filled with a lot of things I could not even say. So I just said, this is me. So the person who was supposed to come and pick me to the hospital, I called and called. The person did not show up. I left. I took a taxi from my house to the hospital. I got checked in. So this is how my hospital suite looks like. It came with a cupboard. It came with a sitting area for my visitors. It came with a very big trash can, as well as a TV was there, as well as a bathroom. Everything was looking so nice and comfortable for me. Few days. Newsflash, my doctor told me I was going to spend 1 day in the hospital, but I spent up to 4 days in the hospital. So that was me. I looked so pale. I don't know how I looked, but I was looking so off. Trust me when I tell you. See, that's one thing with fibroid. If someone tells you they have fibroids, which is symptomatic, for example, causing them heavy bleeding, take it very seriously, because that person is going through some really tough situation, some very difficult situation. So that was me. I was looking just so off. I don't know how I looked. I was looking so off. I was looking so white. I was just looking so washed. Actually, let me just put it that way. They gave me the robe. They gave me a slippers to change into. They had to come and put my cannulas. They came in, they put my cannulas, and trust me when I tell you, as I've said before, that my veins were rigid. Like my veins, by 2021, I already had very rigid veins. And here the nurses are really struggling to put in that cannula, because when I talk about rigid veins, it means that the veins were very strong, like very strong. You put a needle, you feel, when you put a needle inside, the needle, before the needle even gets in, and it seems like the veins were just blocked at that area. But fortunately, they tried as much as possible to fit in the cannula. And one thing they did for me was wearing this leg corset, because the leg compressors were going to be put on me afterwards as to avoid blood clots. Finally, the theater net came in. I had to change my bed. So they moved me from this bed to the theater bed. And the nurse came in to administer the anesthesia on me. So she told me, this is the anesthesia, and they are not going to give me all at once. They'll give me in small sessions. Though that was the first dose she was giving me. And finally, I was being wheeled out of my room, and I was going to the theater, and my friend Vida was there with me, taking this amazing video as they were wheeling me to the theater. When I got to the theater, they gave me another shot of the anesthesia, and they were still asking me questions, my name, my birthday, and everything, and I was still answering, and everything was still going on well. They gave me the third shot, and I was still talking. They were asking me my name, where I work, and I was still telling them everything. The lights in the theater room are so different, trust me, like the intensity of the light. They gave me the fourth shot, the fourth session of the anesthesia, and the last thing I heard was, "Ma'am, please can you put your body a little bit this way?" In the course of trying to shift my body the way they wanted me to shift my body, and that was it. So normally, some people will tell you, oh, they were tiny, oh, they went to places, oh, they saw God, oh, they came here. I didn't see anything. Honestly, it was like a very deep sleep for me. When they were done with me and I started coming back, I knew for sure that I am back. And I was hitting my body from left to right, not violently, but just like. And the lady, the Filipino lady, she's Filipino, she told me, "Ma'am, we are done, just calm down, we are done. Then it came to mind that, oh yes, they are done with the surgery. I was not blank totally, actually. I was not blank at all, because it came to mind when she said, "Oh, ma'am, we are done." It came to mind that actually I went in for surgery, and I was like, "Oh, thank God, they are done with the surgery." I knew when they wheeled me from the surgery into my room, because when they wheeled me from the surgery into my room, they had to lift me up. I don't know how they do it, but they lifted me up from the surgical bed to my own bed, and I knew that they've lifted me up from the surgical bed to my own bed. And one thing I was trying to see was the time. I know when I was wheeled out of my room, I was wheeled out from my room at about 2 p.m. if I'm not mistaken, and I came back, is it 6:30 or to 7 p.m. That's when I came back to my room, because I was only struggling to look at the time so that let me know when I came back to my room. And one thing I noticed was the Anesthesia doesn't really leave you immediately. It departed from my body when session. It was like my head, I could feel my head. Then later, I could feel it like it's draining down. Then later on, my shoulders, I could feel my shoulders. Then later on, my belly, I could feel my belly. Then later on, my knees. Then later on, my legs. So at the time, before I even the leg compressors were already put on my leg, and the massage was going on because they didn't want me to have blood clots on my feet. Basically how the surgery went, and I came back to my room, and because I was very thirsty that same night, gave me like some teaspoons of water. And the next day I farted and I started eating. My doctor has already placed orders for the type of food they have to give me. He didn't want them to give me meat. Anything meat was cancelled out of my diet. So what they gave me was salmon, fish, either salmon or chicken. And from that, I learned a lot, because after my surgery, I've really cut meat out of my diet. I eat much more of fish and chicken right now. That was my first meal. That was my second meal. And the meal just went on and on. The next day, my doctor came to see me.
Post-operative, how do you feel after removing the 50?
One other thing that happened, why I had to stay in the hospital from normal one day, because mostly people who do laparoscopic myomectomy, they stay in the hospital just for one day. I had to stay 4 days because the doctor explained to me that my fibroids had blood vessels in them. They were trying to cut, gave me bleeding within, of which they had to put a drainer within me to drain out the blood that was in me. So that's basically why I stayed in the hospital for all that time, because I had this drainer, and the drainer had to turn into pink or maybe white entirely before I could be sent home. When it became pinkish, the doctor came and said it's time to go home. If I really want to go home, it's time to go home. I was even afraid to come home because I'm alone. I was thinking that something terrible would happen. But the day I gathered the courage, he came back, he said, "Are you fine? You think you can go home?" I said, "Yes, I know for sure that I could go home." So they placed me on painkillers and antibiotics, and that was it. So basically, that's how my surgery went. Few days after my surgery, while I was still in the hospital, what I ate and how I coped with everything. And I also had a catheter in me. It was removed the following day, so I had to start moving around so that I don't have to get the blood clots, because they were always on my neck about the blood clots. I have to try to move around. So that's basically it for me. Everything went well, and I will tell you that Dr. Rajesh was the best of the best. Trust me when I tell you, because with my type of fibroids I had, he did an excellent job. The surgery, the morcellated fibroids were taken for biopsy, and it came back that no cancer cells were found. On the day I was discharged, my wounds were already closed. The post-operation check, when he put his scan he shouted. He was like, "You have a brand new uterus." He said, "This is what I wanted to see." He shouted, "This is what I wanted to see." He gave me a high five. I don't really know what you believe in, but whatever you believe in has done magic for you. He said, "Look at the screen." He said, "The shape of your uterus right now is the pear shape. That is how a healthy uterus is supposed to look like." He said, "You really need to go and thank what you believe in, because I'm not the doer of this. What I'm seeing here is much more like a miracle, because I'm not the doer of this." He said, "I'm just used like an instrument, but trust me when I tell you, I'm not the doer of it." That's one thing I like of Dr. Rajesh, because he did not even take the praises for himself. He said he was just an instrument used to do this. But this healing he's seeing here right now is something that is so marvelous. He just showed me that there's a few stitches. He said, "I can only get pregnant after 1 year." He said, in 1 year, any doctor that would look on you would definitely not see anything. Even if you tell that doctor that you've had a surgery before, the doctor would refuse, because your womb is brand new. That's what he told me. And that could be only God, because at the end of it all, it's still a very long story, but I come to the end of the story right now, and I really want to thank people that have watched it. I am very sure that it's going to help someone out there that is suffering from fibroids, because that's the new pandemic for most women. As per stats, the Black American and the African women face or have a lot more of fibroids than the other races. Now it's not something about, oh, because she's 35, oh, because she's 30, oh, because she's 40. No, I've seen younger ladies of 20, 21 fighting with fibroids. So it's not something about age. It can happen to anybody. That's my fibroids journey. And if you really want me to share the various smoothies and diets I was taking for fibroids that made my fibroids to shrink and came to a total of 15 fibroids that were removed by Dr. Rajaj, then just let me know in the comment section and I'll make a different video for that. So thank you so much, guys, for watching. And if you have any other questions, if you really want me to come out there to answer any other questions about fibroids, about how I handled my heavy menstrual bleeding, just let me know by commenting or asking me a question in my email address that is in my description box. I'm readily available for you to answer everything. Thank you so much for watching. God bless you. God bless you. God bless you. Remain blessed and be a happy soul and a smiling soul. Thank you so much, and bye for now.